Good morning. This is Dr. Tariq with some more phlebotomy questions. This is for state examination preparation. Question 1. When warming infant's heel for a dermal puncture, the heel should be warmed for 30 seconds, 1 to 2 minutes, 3 to 5 minutes, 6 to 8 minutes. The answer is C, 3 to 5 minutes. Blood should never be collected from the arm of a patient that containing options an AV shunt, an IV line, an arterial line, a CVC. The answer is A, an AV shunt. An arm containing dash is never used for phlebotomy procedures. Options are a happen lock, an arterial line, a fistula, a implanted port. The answer is B, an arterial line. Only specially trained personnel acting on a or doctor's order are allowed to collect specimen from options a geriatric patient, a VADs, newborns, mentally impaired patients. The answer is C, newborn. Which of the following is incorrect? Newborns have a higher proportion red blood cell compared with adults. More blood may be needed from a newborn to provide enough serum or plasma for testing. Newborns have a higher proportion of plasma compared with adults. Newborns and infants are more susceptible to infection. The answer is C. Newborns have a higher proportion of plasma compared with adults. Which gauge needle is best for a draw on a child younger than 2 years? Options are 18, 21, 23, 25. The answer is C. 23 is the best. Crying causes an increase in crying of a child. Causes an increase in options are bilirubin, platelet, white blood cells, and creatinine. The answer is C. White blood cell count. It increases after the child cries, so wait till let it come down. Which of the following occurs as we grow older? The layers of the skin become more elastic, hematomas are more likely, arteries move further away from the surface of the skin, blood vessels widen due to atherosclerosis. The answer is B. Hematomas are more likely. Hematomas are more likely. This is the answer. Jaundice mean what? Swelling of the skin, bruising of the skin, swelling of the skin, none of the above. The answer is A. Swelling of the skin is known as jaundice. Neonatal screening for which disorder are mandated by the United States? Options are PKU and hyperthyroidism, PKU and hypothyroidism, PKU and sickle cell anemia, PKU and biotinidase deficiency. The answer is B. PKU and hypothyroidism. If a test is ordered and the patient is not her, in her or his room, you should do what? Wait in the patient room until he or she returns. Leave the request at the nurse station for the nurse to perform the draw. Locate the patient. Postpone the collection. The answer is C. Locate the patient. Which lab department may require special patient identification? Options are microbiology, chemistry, hematology, blood bank. The answer is D. Blood bank. D. Collapsed veins can be caused by too large a needle for the vein, too much vacuum asserted on the vessel, the plunger being pulled too quickly, all of the above. The answer is D. All of the above are causes of collapsed veins. Reason for specimen recollection include all of the following except incomplete drawing of a antiseptic, using the wrong antiseptic, inadvertently puncture of an artery, contamination by powder from gloves. The answer is C. Inadvertently puncture of an artery. It's the reason for recollect. To enhance vein prominence, you can elevate. Options are: you elevate the arm in an upward position, tap the antecubital area with your index and middle finger, squeeze the patient wrist, apply the cold pack. Answer is B. Tap the antecubital area with your index and middle finger. Conditions that may alter the quality of a specimen or cause harm to the patient during a blood draw include: options are edematous tissue, mastectomies, hematomas, all of the above. Answer is all of the above. All alter the quality of the specimen. To avoid reflux of an anticoagulant, you should do all of the following except: keep the patient arm elevated above the heart, allow the tube to fill from the bottom up, remove the last tube from the needle before removing the tourniquet, remove the last tube from the needle before removing the needle. The answer is A. Keep the patient arm elevated above the heart. When performing a butterfly draw using a hand veins, place the tourniquet. The options are: on the patient arm above the antecubital fossa, on the patient arm below the antecubital fossa, 3 to 4 inches above the poking site. A tourniquet is not required for a butterfly draw. The answer is C. 3 to 4 inches above the poking site. The result affected by the patient position include all of the following except: by the way, 3 to 4 inches above is almost wrist at the hand veins. Test result affected by the patient position include all of the following except: albumin, blood alcohol, cholesterol, enzyme. The answer is B. Blood alcohol. Which of the following could be a cause of hemolysis? Vigorously mixing the tubes, allowing the blood to run down the side of a tube when using a syringe to fill the tube, drawing the blood too slowly into a syringe, using a needle larger than 23 gauge. The answer is A. Vigorously mixing the tubes. Next, povidone iodine is not recommended for blood alcohol draws, dermal punctures, blood gas draws, blood cultures. The answer is B. Blood dermal puncture. Povidone iodine is not recommended for dermal puncture. This is all for today. See you next video with some more important phlebotomy questions. Have a good day. Bye.